Already recorded or not? Oh, is it already recorded in yours? Okay. Hello, everyone. Good morning, good afternoon, good evening. Now we're here about the presentation. Our case, the impact of incorrect household waste management on public health. Waste management has become one of the most pressing environmental challenges in Indonesia, driven primarily by rapid population growth and shifting urban consumption patterns. National reports indicate that household activities contribute the largest portion of waste, yet the majority of this volume remains improperly managed. Without systematic disposal, waste accumulate in residential area, causing severe environmental degradation and creating direct threat to community health. So this is our case, Kelurahan Kekalik Jaya. Kelurahan Kekalik Jaya is a densely populated urban area in Mataram City, home to approximately 12,000 residents and 3,500 households. Research conducted in 2025 shows that only 35% of households practice waste separation, while 42% continue to dispose of waste through improper and hazardous methods. Local health records show a concerning correlation between high waste accumulation and the prevalence of environmentally related diseases such as diarrhea and dengue fever. Next, this is the question and objective generated. This study seeks to understand how biological interaction between waste accumulation and disease vector facilitate the transmission of pathogens within the community. There are objectives also. First, to explain a biological mechanism of disease transmission related to the presence of microorganisms, not yet microorganism in waste. Then second, to analyze the specific environmental and health impact of improper waste management in the local context. And then the third objective to propose data-driven strategies for improving waste management and reducing public health risk. So this is the waste management condition. First, accumulation pattern. The lack of segregation leads to organic and inorganic material being discarded together, which often blocks drainage channels and pollutes open public space. While organic waste decomposes naturally, its unmanaged accumulation creates unsanitary conditions that become hazardous and to the surrounding environment. And then the last is environmental degradation. The presence of persistent inorganic waste, such as plastic, further reduces the quality of soil and water, increasing long-term health risks of residents. And then next will be explained by Tavin.
And for the next, biological impact microorganisms. For the first, pathogenic growth, organic waste provides the necessary nutrients and moisture to support the rapid growth and reproduction of harmful microorganisms. For common bacteria, bacterial pathogens such as Escherichia coli, Salmonella, and Shigella can multiply rapidly in decomposing matter, leading to potential outbreaks. In mechanism of infection, during rainfall, these pathogens are carried by water runoff into drainage systems and water sources, significantly increasing the risk of gastrointestinal disease. For disease vectors and transmission, like from mosquito proliferation, discarded containers like plastic bottles and cans collect stagnant rainwater, providing ideal breeding sites for mosquitoes that spread dengue fever. Fly contamination. Flies are naturally attracted to decomposing organic matter and act as mechanical factors by moving between waste piles and human food sources. And for rodent hazards, rats are attracted to food residues in waste, creating additional health risks by transmitting dangerous diseases such as leptospirosis and typhus. Public health impacts. Disease prevalence. Health data confirms that diarrhea remains the most common disease in the area, closely linked to poor sanitation and contaminated food or water. Air quality and respiration. The decomposition of waste releases unpleasant gases, while the practice of burning waste produces smoke and particulate matter that trigger respiratory infection. Vulnerable population. Children represent a significant portion of environmental disease case because their developing immune systems are more susceptible to infections from unsanitary surroundings. Waste segregation and the 3R principle. Source segregation. Residents must be educated and encouraged to distinguish between organic and inorganic waste at the household level to simplify the disposal process. Organic utilization. Implementing community composting projects can transform food scraps into valuable fertilizer, significantly reducing the volume of waste sent to landfill. The 3R principle, promoting reduce, reuse, and recycle throughout the community helps minimize the total amount of waste generated and encourage environmental responsibility.
And for the infrastructure and vector control, we have improved infrastructure, and the local authority should provide additional waste bins and ensure regular, reliable waste collection service to prevent accumulation in residential areas. And for the second one is community-based management, promoting waste banks and recycling initiatives can provide both economic and environmental benefits to the residents of Kekalik Jaya. And the third one is director vector control, strengthening the regular community cleanup activities to eliminate mosquito breeding sites and using covered containers to prevent access by flies and rats. And for the recommendation, we have third. The first one is government strengthening. The local government should implement stronger waste management policies and provide adequate funding for collection, transportation, and recycling facilities. And the second one is educational programs. The regular environmental education should be conducted in schools and community centers to teach proper waste handling, personal hygiene, and disease prevention. And the third one is regulatory support. Stronger regulations are needed to discourage improper disposal practices and encourage long-term behavioral changes among the residents. For the health monitoring and participation, we have third also. The first one is active surveillance. The healthcare institution should continue to monitor the incidence of environmentally related disease and conduct health campaigns regarding preventive measures. And the second one is our collective responsibility. Community leaders play a vital role in organizing local environmental initiatives and fostering a sense of collective responsibility for maintaining clean lines. And the third one is interagency collaboration. Enhanced collaboration between government agencies, schools, and health providers is essential for creating a sustainable waste management system. And the conclusion is the case study of Kelurahan Kekalik Jaya clearly demonstrates that improved household waste management has a profound impact on both environmental quality and public health. And the accumulating waste supports the growth of pathogenic microorganisms and disease factors, which are directly responsible for the high incidence of local disease. And the third one is the path forwards, improving waste management through 3R principles, better infrastructure, and active community participation is essential for long-term well-being of the population. And this is the reference that we use for the paper. And maybe that's all from our presentation. Thank you for the attention, and sorry if there's any mistakes.